We'll open the floor for discussion with the committee. Again, if you have a question, please orient your tent, and we'll start with the co-chair.
Well, thank you very much. Very, very helpful, actually. But what is fascinating is the three of you said the same thing. And there I got 5 messages, if I can. And this is good for us. The first is the rigorosity of the work that you have to do in order to be funded. That's number one. Number two is how focused the project has to be about the objectives of the community or whatever. The third is the impact. Of course, if you talk about vaccination, women and children, this is very impactful to people and obviously the youth. Number four is the importance of the private sector. And number five is with all of these, it's easy that the governments come in and even globally. So I think frankly what I just want to say is to congratulate you because everything fits at least with the concepts that we have about funding. These are to me the 5 commandments. And the question is how this committee come up with this because it's going to be a challenge. If anything we want to do, we need to be financed. So this is why I just made a summary in my own just for the discussion. Thank you very much.
Thank you. Amy. Oh, was this a two-finger? Okay, sorry.
Thank you guys for these great presentations. They were really interesting. A couple questions. One is to Mariam. Chris actually mentioned that at the last investors group meeting there was a report from the World Bank about domestic funds mobilization. And it would be fascinating to see some of the major results. And I don't even know if that reports can be shared with this group, but it would be very interesting to see sort of what the current percentages are and the trends in that space. Also, I was a specific question around with the GFF. What percentage of the funding is actually going through results-based financing mechanisms, is actually tied? And of that, what's on the sort of national level at things like IDA buy-downs or IBRD buy-downs, and what's more at the health facility level through the more traditional RBF-type mechanisms? And then on Gavi, a question. One of the things we saw this morning was a recommendation about the real value that these multilateral entities can play, particularly in the procurement and distribution space. And you were highlighting the really important role that Gavi has played in market shaping and what that resulted in terms of lower prices and then effective distribution systems. As countries are transitioning or graduating out of Gavi, right? You were talking about 20 in the next period, but as we look forward, it's Gavi will be roughly half of the sets of countries, and most of the big ones graduating. That procurement clout is going to presumably decline significantly, or not. And so I'm interested in what do you think the implications will be on your purchasing power and your ability to continue to secure that kind of market shaping role that you played?
You can answer.
Happy to kick off. First of all, I'm very glad that we echo each other's and that there is consistency in the messages across the three. I would be worried if the three of us had actually had very different viewpoints, because I think there is a convergence around the priorities that you listed. Anyone who cares about financing cares about sustainable financing, right? We care about scale. We're not anymore about small-scale fragmented support. So the fact that that's happening is encouraging, and that's where, of course, we're talking about the implications for the U.S. government and for the U.S. government of what we do is so important, because that's been, I think the U.S. government have been a very important partner to all of our initiatives in shaping things and moving things in that direction. The 3 Gs, the Global Fund, Gavi, and the Global Financing Facility, we are, of course, also keen that we at the country level reduce, this sort of fragmented field and ensure that we actually come together and support the government in its finance plan. And that's very much related to Amy's last question. How do we ensure that when Gavi countries graduate, we can find ways of working together to ensure sustained financing from the Global Financing Facility. So how we work together in Gavi Global Fund and the Global Financing Facility in country level is really critical, and help together create that sustainable financing environment. You ask specifically, Amy, about domestic resources. That's really the most, a very important part of the GFF, and maybe the most important and value add of the GFF. It's not the conditionality, but every finance plan has to address domestic resources. And with the economic growth not being quite what we have predicted in many countries, given commodities situation, then it's very important that we think about it over the medium and long term and start to do those projections. Exactly today, where the domestic resource contributions to the GFF is, I think it's too early to say, but we're happy to try to do that homework, Amy, for this commission. Because we have even considered that to be one of our sort of targets and success criteria is over the next 3 years, how much are we able, to move domestic resources, how much are we able to see reallocations in countries towards health as a result of the GFF. So that's clearly one of our indicators of success, and we need to be able to start to pull those together. But I think the only thing you can see at the moment would be budget allocations, not actually where the expenditure is gone. As you well know, that takes some better work on expenditure tracking. To date, the results-based finance has really been an element, I would say, of almost all of our front-runner countries, because that influenced in some ways also the selection in the beginning. So you will see countries like Tanzania that will be tracking results at the facility level, at the district level, as well as the national level, and have a very carefully designed results framework, while you might have a country like Ethiopia where the results are tracked more at the national level in terms of coverage. So countries tailor this slightly different, but there is a lot of emphasis on what you know as basics, results-based finance, with actually us looking at the facility community level at changes and tracking those. We are also keen in the GFF not just to look at results at the country level at various levels, but also disbursement of IDA funding being linked to results, so disbursement linked indicators. And I'd like to give this committee the most recent example of that, which is our first IBRD country, Guatemala, which because of the sweetener of the Global Financing Facility coming in and say we are willing to buy down the interest of your loan, we're willing to do a whole investment in nutrition, and nutrition for indigenous population and the lower quintile. And our negotiation then, or the bank's negotiation, was if you do get a buy down on your interest rate, then we would like to see that reinvested in reproductive, maternal, and newborn child health for your indigenous population. So that's what's really exciting, I think, around countries transitioning, if we can use this instrument to address the equity issue, basically, and do that really powerful. So that's how we are working on the IBRD. Vietnam is another country, not only attracted by the bind down, but actually attracted by our only earmarking. We're doing one earmarking in the GFF, and that is CVRS, right? Civil Registration and Vital Statistics, CRVS. So countries do get a separate funding to address something like that, which if you have a strong prioritization process, you may not end up prioritizing CRVS, but it's so fundamental and such a core public health function. So countries that are interested in that, as I said, in the case of Vietnam, are very keen to get the support from the GFF for that particular public health core function.
So on market shaping, so Amy, you're absolutely right. And one thing I just want to mention too is that, in this next strategic cycle, obviously market shaping is going to be a huge area of work for us, not only in the existing vaccines that we work in, but we're also looking to see how can we do some of our market shaping with other areas, so cold chain equipment, things like this, things that are similar in the sense that there's a real need for more supply of this, and how can we use our expertise to benefit other things that are needed for immunization. I mean, I think your point is obviously it's a pretty critical question, and I think these are areas that we are really working through and thinking through. What is the role? I mean, clearly Gavi will not be financing these entities anymore, but is there a role for Gavi? And I think those are things that are being looked at. I mean, the one thing I will also say is that we are now getting, I mean, there were a few that were mentioned at our replenishment, but a number of the manufacturers are also guaranteeing that countries that graduate will get Gavi prices for at least 5 years. And I think that actually is a pretty critical piece, because when you talk about the pricing that we get, it's pretty low. And I think what you don't want is suddenly, this massive, if we're trying to create the fiscal space for countries, and then all of a sudden the denominator of the costs of the vaccines suddenly skyrockets, that is pretty much a way to fail. And so it's very good that a lot of the manufacturers are thinking about this, are doing it, have agreed to do it, and we're working with more to ensure that countries have the ability to have those prices as they move through sort of the post-graduation period.
And certainly I think PAHO has been incredibly effective at also maintaining pretty low vaccine prices through their own, regionalized mechanisms. So I think this will be managed.
Okay, Gisela?
Thank you so much. This is really interesting, and the impact you've achieved is really great. I just have a couple of questions. Firstly, is for the GFF. I'm just wondering, and I know you've explained a bit more about what you do, but do you have specific impact examples of what you've actually achieved at country level? So maybe it's me, I'm struggling to get that detail in terms of what you've achieved, but in terms of the fund, it's really great. And so that's the question for that Gavi. I think it's really brilliant. You've articulated it so well, just really explaining what you're hoping to achieve in terms of outcomes. And then Claire, in terms of the UN, I think for me, what really struck me is the point that you're trying to get the political buy-in, getting from the Ministry of Health to the Ministry of Finance and Prime Minister level, because we know that health is linked to economic growth, and part of the issue is that health is not prioritized enough because you don't see enough about impact and outcomes. So ministries of finance and presidents sometimes don't want to put more money to health because they feel it's just going into a black hole. So I think the work you've done and the examples, how will you help through the UN system to try and get more traction and get more countries on board? Because I think that is so critical in terms of bringing different partners together and getting countries to really own, health and actually put more into financing as well. And that's it, really.
I'll piggyback a question onto hers. Again, congratulations to the whole group. Sorry. Yeah, no, congratulations to the three of you. But I'd like to echo your question. Obviously, the financing has been very successful, and I'm impressed. The Gavi has shown some outcomes, but the other outcomes, I think, are a little questionable in terms of evidence-based, because the fact that you've had impact on one area of the country could be that the country has other programs that are also impacting. So without comparison, it's very difficult to assume that some of those outcomes are due to your program. So that's something that the question of scalability. Gavi is obviously large scale, but you can also have success. There have been too many projects that have been pilot programs, one region, they become national, and they don't succeed. Cost effectiveness, I don't see any data on that as well. Another success is the partnerships that we've created at different levels. That's a great. And then the last point is also long-term sustainability beyond not only the scalability, but also the sustainability. Obviously, Gavi has been doing this for a long time, but what happens when governments take over some of these projects? But again, congratulations. The last quick point is that it's amazing how much work you're doing, how little it is known. but those in the development community. So I think you should do a better job of marketing. Gavi's work, I was well aware. I don't know about others, but congratulations to all of you.
Sure. Well, I mean, to Zill's question about how do we, get the message out and help more countries sort of take ownership in this way. I mean, it's really, honestly, it's tough, and I think a couple of ways that we're trying to work. One is it's working country by country and with ministries, and unfortunately, there's not a wholesale way to do this in some sense. We're with partners, and we're building the Financing Alliance. It's actually a startup, about a year old, that came out of this work, which was actually authored by Minister Cassette, Ray Chambers, who's my boss, Tim Evans at the World Bank, President Sirleaf. But one of the recommendations was we need to create a financing alliance to help countries in this way. We're trying to actually get funding to be able to do this, but we think it's critical to work country by country with these governments and help make the case. I mean, look how long healthcare reform has taken in this country, right? And it's kind of, I think, arrogant for us to assume that we can do this quickly in any place. But the second is also then to work through regional mechanisms. And I mentioned our partnership with the Ministry of Health of Ethiopia. And they've been so successful with seeing their maternal and child mortality rates come down, but also with taking ownership of their primary care system. And those are linked. But asking, and there's now, new cabinet ministers and a new Minister of Health in place, but asking them to take some leadership with their counterparts. And they have credibility that certainly I'll never have. Working also with the University of Global Health Equity in Rwanda, and getting those folks as well as WHO Afro to own this. So we're trying to work both through the formal mechanisms as well as really through who we see as sort of peer leaders on the continent to help with that.
A quick question.
Yeah.
I thought you were going to talk about like the UN system,
Yeah.
because you have the UN General Assembly where you bring all the presidents and prime ministers together. I've been attending for the last few years. There's been no mention of this in any of the meetings. So I feel that's a lost opportunity, and that's partly why I raised that question.
It's a good point, and so through the UN channel specifically, so my office is actually, we're sort of part of the UN, but we're also a little bit outside, so it gives us nice flexibility, but we work very, very closely with UNICEF and with WHO, of course, and through the country teams there, we're working on all of these things. And then I think your point is right, we haven't raised this, really the first time this became even relevant or recognized was Financing for Development last summer. And that was, this report was actually issued alongside that. But we're looking for, increased opportunities to raise the visibility as all countries think about this.
You raised a very important question that I should have started with. What is the goal of the DFF and what's the specific targets? So the goal is to eliminate preventable maternal, newborn and child deaths by 2030. So it's a very important goal that most countries have signed off on. All countries have signed off at the World Health Assembly to reduce maternal mortality to 70 per 100,000, bring down child mortality to 25 per 1,000, and newborn mortality to 12 per 1,000. So those are the targets that we're keen of. That's by 2030. So each country then, in order to reach those ambitious goals, are developing coverage rates, proxies, targets over the next 3 years, 6, etc. So for each round here, we have very specific targets to reach to those ambitious goals. The countries will do so, to your question about impact and cost effectiveness. So the DFF ensures through that initial prioritization exercise that you prioritize the highest impact, the most cost-effective interventions that are available. So it's really helping countries to focus resources on high-impact, documented, cost-effective interventions. So that is the starting point. How do we scale up what we already know is cost-effective?
What I heard you say is that you select evidence-based approaches, but how do you know after your programs are done that they're still cost-effective and having an impact?
Yeah, no, that is an excellent point of view. So that it really shows the importance of having very strong monitoring and evaluation, and that we start by doing an assessment of what are the monitoring capacity in countries, because as has been pointed out, part of all of this is to build the capacity to manage these ambitious country country national programs in partnership with others. So what we do is doing an assessment of where is the country in terms of its current coverage rates, working towards universal health coverage, and where are the greatest barrier to scaling up those. And most of the GF money to date is going into addressing those barriers across reproductive, maternal, child health and adolescent, which are actually building more resilient systems where you have the right people in place with the right commodities and the right drugs. So I think you pointed to two things: the importance of monitoring and evaluation, especially when you have ambitious goals as we do, and secondly, to communicate results. And I must say we haven't been very good at that. We have been so eager to get up and running, because another thing is the Global Financing Facility has only been around since a year back, 1 year and a few months. So it's too early for us yet to do so. But now, as we start to get learning from Liberia, from DRC, Northeast Nigeria, Ethiopia, Tanzania, Mozambique, we need to start to actually share those findings with all of you, but also all our partners. So that's a very important point, strengthening the documentation and sharing of results.
Can I just go back on that? So you don't have, sorry, I'm really sorry, I think maybe I'll take offline with GFF. It's just because it's a huge fund, and I'm still not quite sure about the impact, and, you know, because I know you've been trying to get different governments involved and all that, but so far I haven't heard in terms of what the impact really is, even one example from one country.
Right, so you are actually echoing what many partners say. They want to see those results that's coming out from our front-runner countries. So we have, you know, the initial results from countries like Liberia, one of the front runners, and others. Tanzania is probably too early. But some of the countries are starting to show results, and we need to share those, because what's important here from a country perspective are two sets of results. One is the process itself. Most countries are report to us that what's been most important with the Global Financing Facility is the ability to bring partners together and to align around a common set of results, and then to start to show traction. So impact on mortality reduction, I think we will start to see in, 2-3 years, but impact in terms of results, coverage rates, we should be able to start to share that with you as we are learning from the first countries this year.
I think it was your comment about getting all the players together in a country. And, just one thing to add. So we are actually in a pretty lucky spot currently, in that our new board chair happens to be the former finance minister of Nigeria. So having Dr. Ngozi head our board, this is actually, it's an incredible support to us, because what we're doing a lot more of is having those conversations with finance ministers, because, she says this all the time, that, everybody's coming at the finance minister with this is important and that's important and this is important. And I think having that inroad to talk more to finance ministers, to have them understand the cost effectiveness of immunization, and there is a lot of data around that, I think is, we are, it's a good place for us to be in, especially given what we have happening in the coming 5 years. So I just wanted to comment on that. And I think around communication, I think, I think this is going to be a key activity for all of us in the coming years. I think, as I mentioned before, we don't know how much this new administration knows or understands about this work, and I think there are really strong ways to communicate the work that all of us around the table are doing, and I think especially around the area of financing, I would hope that these would be areas that they would be interested in. So I think we all have an expanded job to do more and a better job of communicating the work that we're doing and the impact that we're having.
Madam Chair, I could also, to the questions being raised, send some country examples of the results that's been achieved to date, so that is, so you have those available.
Thank you. To Megan.
Okay, thanks. That was excellent presentation. So a specific question for, I guess, Claire and Natasha. Um, Innovative financing is great, but the U.S. government doesn't often participate in these. And we had, I think maybe Natasha, you remember this from the AMFM program, or maybe I don't know if any of you were in the Affordable Medicines Facility for Malaria, which was innovative. Lots of countries pitched in, but the U.S. just sat out. In fact, created a firewall at the Global Fund to say that its funds could not be used for this. So there's this strange sort of dichotomy between wanting to use private sector and markets for, as sort of a philosophy in the U.S., but somehow these are not the mechanisms that are preferred when dealing with assistance for health, because the model of saying I buy a box of antimalarials, I drop it off in Mombasa, and I come back and I know it's there. That's delivery for me in a sense. So given that this particular committee is around what the future is of where the U.S. might engage, and to see whether the U.S. could move towards some of these more innovative financing models, what are the challenges here? I mean, where has the U.S. participated? Ariel putting in money at the country level, that's great, but that's Ariel trying to find a creative solution around certain problems. USG as a whole, are we likely to see movement in the direction of any of these great ideas that you folks have? That's number one. And the small side question is on the IFM bonds. What has happened to the risk premium on those bonds for the U.S. commitments on Gavi going forward? Has that changed somehow now with the new administration? Is that public information on what the pricing of these bonds is?
I'm actually not sure. Sorry.
Okay.
I'm not exactly sure of what you're asking.
Oh, I'm asking about, well, obviously, I would ask for a greater risk premium on a bond if I'm lending you money against a commitment from a country who I'm not sure is actually going to pay in its commitment the next year.
Yeah, okay.
So
I have a two-finger on that very quick.
Okay.
I would like to, on the first question he asked, as I did this morning, could you be very specific and tell us, if you were writing this report for this coming administration, what would you like us to say about this issue? What should the U.S. government do? As specific as you're comfortable being, it would help us, given the question that you've raised, and given the history of the U.S. behavior in this area. We have to be very strategic in this particular case with this administration, bearing in mind they're businessmen, and they're going to move quickly, and we need to give them guidance, hopefully, that they will at least read.
I'm right with the two of them. Just my thing to you, Natasha, who are you going to be talking to get your 2 years worth of funding that they pledged? So be specific, because I want to know, who is Gavi going to go to and say, you owe us $800 million? And what date is that owed?
And this is not a reflection of the wonderful presentations you made.
No.
We're bringing you down to the world that we are living in right now, okay?
Sure.
Be sure you realize that.
Yeah. So I can start. So I don't know that I have all the answers, but I will certainly try. So your question about the participation of U.S. government in innovative financing. So I have to say that the world of innovative finance, I came to it through Gavi. In my past experience, I hadn't really dealt with mechanisms like this before. And look, I think there's a couple things that one needs to realize, and they just are what they are, and then I think there are ways to move the ball forward. The first is that the U.S. government by practice cannot participate in certain innovative financing mechanisms because they just don't fund past 1 year, right? And that deals a little bit with your question. We have an annual budget process that happens. The administration provides a number. Congress decides, is that too low? Is that too high? Whatever it's going to be. And then
many other countries have that same constraint. That's not necessarily a binding constraint.
So, and again, we got over a little bit of that constraint when we actually got the first pledge out of the United States. So, when the Global Fund when the Global Fund was first created, it was an annual contribution from the United States. And I'm trying to remember what year it was. It was 2010, actually. It was the first year that the U.S. government was convinced to do a pledge, but it was a non-binding pledge. Now, how do we make that work? I mean, the argument we used was that you were doing it for IDA. Why can't you do it for Global Fund or Gavi? Because I think my understanding is the U.S. also provides multi-year commitments to IDA. So I think that is something we should look at, but I think that is probably a very big barrier to people, is the annual budgeting process, and the appropriators don't particularly like it when they're told that they have to do something that they didn't necessarily really have.
That's only one constraint, right?
Uh-huh.
Many other ways in which.
So, and again, the other thing I would say is, look, I agree with you. I think that, we have been actually talking about this internally, in that, there are many other donors to Gavi that are doing different ways of financing, right? IFM is just one idea. There are others. And I think there is a real push to try and figure out what is it that the U.S. government could do. And I think one of the rationales that could be useful is the fact is that ODA is likely not going to increase over time. And we hope that it even stays for what it is. So what are the different and innovative ways that governments can help support these programs, get them to be sustainable and get them to graduation without having to actually write a check every year? So it's not necessarily easy, but I actually don't know that we as a community have really tried, to be honest. I mean, I know that for AMC that we were almost there, and then there was a back out of it. I don't know why, but I think some of it is the way we budget. It's different, and I think people have to think about other options and how do we get over some of those things that we can't get over. To answer your question about where do we go for the money, so right now, and I hope I don't get too wonky here in a different way, is the 2017 budget is sitting in Congress right now. It is being held by a continuing resolution that will expire next Friday, and they need to make a decision about what's going to happen. It is likely, I'm assuming this is all sort of public now, that they're going to probably go with a short-term continuing resolution, which means they will not close it up, and it will go into next year, which is a little weird when they also are supposed to be putting together, the administration should be putting together an FY18 budget. But they're doing this, I'm guessing, is because all of a sudden you're going to have a fully Republican-run government, right? Congress will be Republican, President will be Republican. So it provides them a little more power to do certain things that they may want to do with the budget. And these are areas that, we are obviously looking at vigilantly, and also making sure that wherever, there are potential cuts, how do we make the arguments that, that programs that are working really well continue to get funded at the same level. And, the last year of our pledge is, it starts with the administration putting out a number and then going through this process that I just talked about earlier.
And just a couple of, yeah, sure. Yeah, a couple of these specific questions as well. And I can't speak to the politics at all of this, but just from what we're observing in the specific question of what recommendations would you make, or would you ask the U.S. government to do? First, I would say, I'm not in favor of the idea of czars or bringing new groups, and we have the discussion of the F group, and I don't know the history quite of that, but I would say that with the innovative finance in particular, what we're finding is that there's so many disparate pieces of this around USAID, then with Treasury. It's really hard to find answers that are consistent, consolidated kind of set of tools, and knowing how to engage, and it takes just a tremendous amount of time and work, and it makes us not want to work with USG, frankly, and to work with other guarantors and donors. So I actually think there's an opportunity to maybe create an innovative finance group that can work across USAID, but also with Treasury, with OPIC, with the World Bank Group, to really help crowd in private investment. And frankly, I don't think that we're going to be able to do things differently, and by that I mean bring in the private sector, unless we do things differently, and actually have a higher tolerance for risk as well. And related to that, I think there's actually opportunity to change some of the rules around things like DCA and what it can and can't guarantee. And I believe that's actually a congressional authorization rather than an executive branch, but I'm not an expert in that. But those rules are really, really tight about what the U.S. government can and can't guarantee. It can't guarantee sovereigns, for example. That has to be through Treasury and through Congress. So relaxing some of those rules to basically permit a wider basket of guarantees would help do some of these innovative debt mechanisms better, or enable them more carefully. And then this point about capacity at a country level, I think that there's opportunity to put more finance staff within USAID, within HHS, and then to help country partners really develop this expertise.
I think the key arguments here going into changes, whether it's in the US or Europe, even Northern Europe that I represent, is really ensuring that one gets value for money, for taxpayers' money, and accountability is key. So any financing facility or mechanism has to have a very strong governance and accountability mechanism. And I think that's one selling argument for the GFF and for our partner Gs. Results is taken for given, but I think someone raised the question of attribution to, which is always difficult, especially when you work together around and aligned around results. But working out ways to have attribution even when we are pooling resources around common goals. The selling arguments, I think, around private sector bonds, social impact bonds, is really the ability to de-risk those. That if you encourage the private sector to take risk, what can we set up as ways to de-risk those investments? And I think that is what is really exciting about, for example, partnering with IFC and for us in the Global Financing Facility to be able to put up money that de-risk such, innovative, risky investments, because these are risky environments and investments. A third thing is fungibility. How do we reduce fungibility? And that, again, by having a very strong results-focused and results framework, and by working with the country's national budget, which we do in the GFF. We work with Ministry of Finance around one budget, where countries are able to make a case for more allocative efficiency. That's the case you make with your investment case. And by being able to improve and strengthen our ways to track expenditures. So I think any ways that we can creatively think around reducing fungibility, increase accountability, de-risk investments, that I think is how we get a changed administration really keen to see how they can partner around what is also the interesting thing here is, of course, the programmatic area we're talking about. We're talking about mothers and newborns. Everybody cares about mothers and newborn. We care about women and children. We know that they are central. So again, the broader theme here around birth, mothers, newborn, early child and adolescence, those critical periods in the life cycle, not having them compete against each other, but that there is a continuum, that's the best investment for the future and for security. You are asking the argument here, what's the argument we're trying to do in Southern Europe with an enormous immigration pressure, is that if we can work across the Sahel on the demographic dividend, then we help reduce the pressure there. So I think there is a slightly different arguments one can make around demographic dividend, but maybe here I think very much the argument is around the unfinished agenda of all useless, wasteful, all deaths are wasteful, but those deaths that can be prevented in mothers, children, and making investments around both survive and thrive, which fits very nicely with the SDG agenda. So I think you probably have many strong arguments that you've been pondering, but I think we can help make the rationale really strong from a finance point of view.
I want to follow up a point you make right there, which is, what everyone cares about. Birth, women, children, and I think, and security, and we have talked about on this committee what are some of the hooks to get the administration and to listen and care about the agenda. But at the same time, how do you make sure that the investment, from your point, since we're talking about financing, the investment that go into achieving these programmatic goals that everybody cares about, a layperson appreciate, but yet understanding that we are building an investment and infrastructure, investing in an infrastructure that will do more than just the children, the newborn and the mothers, because that alone is not going to solve our problem. And because I think oftentimes, not necessarily in global health, because this is new to me, but certainly in health and medicine, we see that all the time. Things are being built for an objective, and they're built only for that, and never to be used again, and cannot be reused. And I think from a financing perspective, you ladies actually are sitting in a very powerful position to enforce that, because if you can communicate to your investor that message, which I think from an investment mindset, that is actually a very strong message, because there's an amplifying effect on the return on investment, and bring that into, I guess, the contract, whatever you call them, the debt instruments, then you're mandating some of this work to be done so that the benefit is cross-cutting rather than singular and focused. So how do you think about that?
I think you're making a great point. And for me, the most exciting thing at the annual meetings at the World Bank was when 8 ministers of finance stood up and said why nutrition is important, right? And so that is what are those arguments that makes ministers of finance or important donors on bilaterals value what we're talking about here. And I think one thing is really to change the discourse or discussion around people. Like we're not talking about disease by disease or intervention by intervention. We're talking about people. We're talking about mothers and newborn, children and adolescents. If we can first talk about people, that to me opens up to a discussion around the risks that they face and outcomes. So then the next discussion then is for each of these critical periods in life, what are the highest impact interventions you can make, be it in health, in water sanitation or in education. And they are a few. So really zooming in on those highest impact, yield for money, value for money at those critical periods. Otherwise we end up with a strange dichotomy or competing between interest groups here, but looking really around mothers, newborn children and adolescents, the critical interventions, and then if you take a look across interventions, you end up with very few key bottlenecks that any investor would be interested in. So if I want to scale up, what is it that's holding back scale up? And then I would say, well, resilient primary healthcare system. It's investing in primary healthcare. It's investing in integrated community outreach, where already the U.S. NGOs have a very strong history of working on integrated community outreach activities. So it taps very nicely into some of the strength that, for example, the U.S. have in the CSO community and NGO community, because really it steers us towards investments in primary health care, where we have, of course, the biggest bang for the buck.
But can I just clarify one thing that maybe? No. Okay.
We've got to keep moving. All right. No,
No, thanks. I wanted to actually ask you more about private sector funding. And so when I think about the challenge right now in global health, on the one hand, we have the big funding, global funding that we're talking about here. You, of course, have microfinance, micro-lending, micro-insurance. But then we lose the middle, the let's call it medium financing, which could build Juan Carlos's hospital and could build the distribution networks in a country. And then I was thinking, with this administration, given the number of hedge fund managers and private equity executives that are in the administration, if you had the ability to co-finance, venture capital or private equity investment and/or provide tax incentives to do investment in healthcare to support infrastructure in poor countries, there's probably a reasonable business case, though it's not probably needs to be worked up. And does the group see that as an opportunity? When I think back, you had examples like the Acumen Fund and IFC at the World Bank. I mean, many efforts to do this. But I think of a concrete recommendation we could give the administration. You could either tell them, look, you need to fund Gavi and fund the international agencies, or in addition to that, we can say fund those and then also do this, enablement of private equity and venture capital investment. Curious to hear your thoughts.
Sure. I mean, it's a complicated question, and it probably requires longer thinking and discussion. But there are actually, for example, Abraaj right now. You probably know Abraaj is a Middle East-based private equity fund, and they're actually developing they wanted to develop first-class hospitals throughout Africa and Asia and South Asia. And we met with their principals because one thing that they're looking at is actually, well, we need to build a pipeline of patients into those hospitals? And can we use community health workers in a way to build that pipeline of demand? And, our conversation with them was around, well, how do we ensure there's equity in this and that we're also meeting some of our global health goals? And I think that's the rub, right? Because these private equity funds are going to go look for return, and Abraaj certainly sees return in building hospitals in Nairobi and Karachi and places like that. But how do we get them to actually go take those patients as well who may not be able to pay today, but maybe sometime down the road? And I think there is probably tax policy we can use, and probably helping, offset some of the income or the tax base that those funds would owe if they've actually taken on responsibility for patients that they wouldn't otherwise see. There's maybe a cross-subsidy whereby the U.S. government could put in funding to support some aspects of that program, the community health outreach or the primary care, alongside Abraaj, as an example. But I think there's creativity that's going to be required, and kind of to my earlier point, I haven't seen that creativity and that flexibility yet in what USAID can and can't do. So I wonder if the president-elect and his team can help think about, potentially setting up a fund that could invest alongside private equity, or tax provisions, work with Treasury on some things like that. I think there's huge potential.
Just a two-finger. I just want to point out that, in the United States, all of the supplies and healthcare commodities are distributed by private companies, right? It's only in global health that we expect that somehow this is all sorted out by governments. If you give an entrepreneur in Uganda or wherever capital, I'm guessing somebody could set up a business that has a pretty good return just to distribute the commodities that we're talking about.
Absolutely. Cardinal Health and McKesson are multi-billion-dollar businesses, as we know.
Their surgeries, they work forever.
Well, if you think, sorry, one more quick, just brainstorming. You think about like the Aravind Eye Hospital, where you have probably some of the best cataract care in the world in Madurai, India, where they provide it for free to the vast majority of people and charge a subset. And even Apollo hospitals now in India are increasingly doing that. You could find probably a model here and actually unleash private money to actually build some of this infrastructure for your hospital.
That leads into my question. Thank you. So thanks for a great presentation. This question was actually triggered by the picture of the big drop of water that Natasha put on the, but then I would love to hear the rest of your comments on it. I'm curious about the psychology of investment. For example, is part of the reason that Gavi has been successful in terms of getting those millions and billions of dollars from government because it's something that's dealing with vaccinations, immunizations. Is that going to be different from investments, for example, in hypertension, diabetes, obesity? Those are just really different kinds of conditions. And yet, when you think about the return on investment that Claire was talking about, there's certainly a return on investing in the prevention of hypertension. So I guess I'm curious just in terms of your thoughts about how the landscape might change when it comes to NCDs, diabetes, hypertension.
No, I think that's a really good question. And, I think one of the reasons why I think Gavi has been successful in doing what it has is that our impact is very easily measurable, right? How many needles did you get in a kid's arm and children's arm? So I think that's a big part of what we do, and it's very clear that if you spend $1 here, this is what's going to happen in return. And so I think that's one of the reasons, I think we have been successful in having donors understand what the value for money is and what the impact is for the money that they are providing. And in some cases, I think there are donors, in many cases actually, that there's a multilateral, bilateral thing going on, right? So, you use, in immunization, it's much less, but USAID has a bilateral immunization program. It's small, but it is important, and Gavi is actually, we need that to make sure that it's working well. And, with HIV, it's obviously much bigger between the Global Fund and PEPFAR. So I think that's one thing. It's a really good question around NCDs, and I think part of it is the attention that it's getting. I think that, you know, global health has just been very lucky in that, you know, we have been able to keep people's eyes on the work that is being done. And I think generally, again, I think some of it can be done better, but I think generally we are doing a good job in showing what that impact is. So I think that, you know, it's about bringing more attention to those issues. I think that's, and again, can you show the same kind of impact for, you know, $1 going from, you know, an agency going to hypertension and what that result will be? I think that is really being able to come up with what's the, you know, the investment case on this. And I think that, you know, these words investment, you know, the more financial words are going to become, I think they're already gaining momentum. And I think we will see a lot more of that. And, you know, and I'm not the, you know, private equity person. I'm far from it, but you know, but I do think that these are things that will be of interest to people, and it's about, you know, the two sides coming together, not only to highlight what's important, but then to show what the impact is and how these new forms of funding can provide a return to, you know, some different kinds of players.
Well, if I could follow up, first of all, thank you for some wonderful information, but one of the things I think we're having some challenge with is really segregating out what I would call the classification of global fund support. And that is that which is service directed or practice directed is very clear and evident, which you really have highlighted here today. Gavi is a classic example of that. You buy a vaccine that already exists, you make sure it gets delivered into country and have incredible outcomes. But where we're really having the problem today is actually upstream from that, where how do we get the vaccines that we really need that have no market-driven kind of world? Ebola virus vaccines are languishing right now. People don't realize that. If we had another big situation in Africa, we'd be screwed. One of the top 3 vaccine manufacturers that invested over $300 million just dropped out. You know, people don't understand that, and we have this with another number of other vaccines, and we have it with point-of-care diagnostics. We heard this morning about how if we just had better medical practice, we had better medical services, we could do better. We're not doing any better in this country with influenza and antibiotic resistance right now with great medical care, okay? I mean, so it's not, and those are 2 of the really biggest risks we have today in terms of global health impact. So could you give me a sense here of how, I think to get our arms around this, we really need to look at what is the investment in the actual delivery of existing services that we know how to do, and what is the global health finance budget and procurement and you might say just awareness system look like for that which is yet to be funded. And we have in the past said we'll always fund it on the back of the private sector, but the private sector is not going to do it anymore. I mean, you only have to burn these guys a few more times and they're done in terms of trying to respond in a crisis situation. So how do you factor that into global financing?
As you know, there is a commission under Larry Summers' guidance who's trying to look at this. Which traders do we make with regard to direct service delivery and support at the country level versus global public goods? And I think that answer isn't yet answered. I'm sure you were trying to do that here too. But finding that right balance, I think, is a very challenging one. And I think we need to really think carefully about that, because you do want to ensure, of course, that the global public goods agenda is critical and remains. But at the same time, we have some, frankly, low-hanging fruits in getting increased coverage and direct support at the country level. And I think that's important for another thing we haven't talked about here right now, but maybe you did that earlier today, and that is fragile settings. And insecurity in fragile settings is also where increasingly the burden of disease and disability is concentrating. So if we can do more about that, then of course we are also addressing broader issues. There was earlier raised this thing about infrastructure. The biggest contributor today and growest share of development aid for infrastructure is China right now, and second to China is UAE in the Middle East countries. So the question is, do you want to be out there in that field where they are already pretty large, or do you want to build on that infrastructure investments by others to buy results? So here is instead, could the US government, as it has done always, said, hey, we want to make infrastructure actually work for people, and we come in with this, whether it's the software or the complementary funding. I think that's the case, because we want to see results. We don't want to continue to see, shells. And that's the argument we are making in the global financing facility to the Chinese. We say, join the global financing facility so that you can shape those kinds of investments that will make use to your infrastructure. We are making that, increasingly now because of this enormous thrust on building things or things that you can put a logo on, like Apollo. Apollo is great, but how does that work for primary healthcare in UP and Bihar? So if we are interested in those areas and equity, which I'm sure is not the selling argument anymore, but if we do care about fragile population insecurity, and the disproportionate burden of diseases in certain areas, and steer things in that direction, that might be ways which one can make forceful argument around. Yeah. But I think the point you made about direct support to service delivery versus continuing in securing investment in the global public goods is a very critical question that I hope this committee will continue to think about carefully, because it could have enormous implications, what you recommend and what the outcome is.
Vasant has a two-finger, and then we will go to Amy to have the last question in our last 5 minutes.
Well, just a response to Mike's question. I mean, I think at least in pandemic influenza, for a time with BARDA became a market maker, right? They made a market through purchasing stockpiles of vaccines that actually got 3 or 4 companies to actively develop, produce vaccines so that it worked. Now, as BARDA funding has been taken down, there is no market maker for Ebola, for SARS, for Zika, for anything. And I think one question, I think the committee, we have to come to a conclusion on, is one of our recommendations that, A, does the U.S. government still need to be a market maker? Do we need the U.S. government to get all of the other governments who never really participated in this to be a global market? Because otherwise, I think these kind of one-off funding arrangements where you have a little bit of money for a couple of years, nobody's going to come in. I mean, it's been burned too many times.
I wanted to just say one thing, if it's okay. So talking about Ebola, and I don't know that this answers your question, but I think it does lend itself to how we can all be thinking creatively around some of these issues that are, that we don't know how to solve them yet, but we have to figure out how to solve them. And, earlier this year, it was almost a year ago, Gavi actually created an advance purchase commitment on Ebola. And now we are, there's a lot of work being done with at least one manufacturer. I think there could be another one that's coming into play, but it really did show that there was some purchasing power there, and again, I think we have to see what the vaccine looks like and all of that. But we have agreed that once we have a licensed vaccine, we will pay. There's at least $5 million going to that, and there could be more to do a stockpile.
The same company that you're negotiating with $5 million has spent over $300 million of their own dollars. So to get $5 million back on a $300 million investment isn't looking real good. And so I think you're absolutely right. The problem is there still isn't the market draw there. If we were doing this right now, we would be vaccinating with one of 2 vaccines. Every African healthcare worker, every emergency responder, every taxi driver, every burial team member, everybody who could potentially be the rod in the reaction that stops the next one from going. And we don't have that because we don't have a market-driven system where somebody's going to buy that. So I think I give Gavi great credit. Trust me, I think you've done, and Seth's work and all of this with SIPI and so forth. But when you're a company and you invest $300 million, you say, but I can make $5 million back. I mean, what the hell good does that mean?
Yeah, it means you don't get to keep your job for very long if you're in the company. Just one real quick question, which was around, has Abraaj actually been successful reaching its $1 billion funding target? They're close.
I think they're getting close.
Okay. The second question was around, we talked about sort of the pure venture capital. We've been talking about domestic financing as sort of different pots, different pockets of funding. I'm interested if you all have any thoughts around the whole kind of fragmented, growing space of impact investors, so groups that aren't looking for some sort of pure market level return, but are looking for something more than just pure grant, and which is, it appears to be like burgeoning up, but very messy, very fragmented, a lot of sort of differences in terms of risk expectations, return expectations, health targets, all the rest of it. And I'm just wondering how you all are thinking about that world, and any advice you have to us about that, and what the U.S. government may or may not be able to do around it.
Yeah, I'm going to do a two-finger piggyback on Amy's question, which will be the last question, which is, wasn't Gavi funded by Gates, a major, big, deep-pocketed, anchor investor, versus, some of these impact, which also tend to be high net worth individuals with, a do-good attitude, coming out of their challenge, their giving, challenge, but the sustainability often isn't there, and they can get distracted. So I'm just asking about the sort of environment of the one question was asked about the type of disease and how that would impact differently Gavi's success, and I'm asking about the financing, and it seems to me that Gavi is extremely successful having Gates be that major investor, which actually pulled U.S. government and other people into the space with them. So that's I don't hope I didn't dilute your question.
So I can sort of start answering your question. So yes, Gates, vaccines are a very important thing to the Gates Foundation and to Bill Gates himself. And so, yes, they were a big part of our creation, and they continue to be our second largest donor. The UK is now our first largest donor. But I think that's true, that when you have an anchor who can bring in, other key players, that has, and especially if you have an anchor like the Gates Foundation, that can be helpful. Amy, to answer your question, I think we're actually looking at all of this as, a new bucket of work, right? Again, Gavi, I think, has been a little ahead of the game when it comes to innovative financing, but, these two mechanisms are not the only two mechanisms, out there. And I think there are lots of different things that we should be looking at and figuring out what works best for a system like ours. Because I think, what might work best for Gavi and the Global Fund would be very different for, a sort of direct service provider kind of organization. So I think it's something that we're looking at, but I don't know that we have the answers just yet.
And just to your question on the impact investment community, it's an unruly bunch right now, right? And I think that they're still in a phase a little bit of thinking about definitions of what this means. What are the metrics? There's a lot of new types of ways of measuring what impact is. How many bottom lines is that going to be? And primarily we've engaged with them in sort of two ways. One is on the equity side, and that's what most impact investors are doing. They're looking for, especially, things like the hospital chains that they want to go invest in that might have a social benefit, but also some upside. And I think the Canadian government actually has been a helpful matchmaker in some of the platforms it's set up. I think the U.S. government, through some of the grand challenges, kind of competitions and things have been run, can continue that. So being a matchmaker fund and matchmaker in sort of the startup or the companies looking for equity investors, and then the impact investors that are based here. And then second is on the debt side. Well, the bond structure that we're looking to develop, and I believe the IFM structure as well, was actually looking for traditional institutional investors and trying to make our mechanisms as attractive as we can to that broad group of hedge funds and pension funds and things. I think as we get more sophisticated in our thinking, there'll be ways to tailor this where instead of a grant financer who can do the pay-for-performance aspects, perhaps it's an impact investor who's willing to give up some of their upside to help kind of coax countries toward specific health metrics. But I think we're really in a new stage with that. And I think that, if the administration can help with tax policy, with creating a framework, with serving as a matchmaker, that'll go a long way.
Well, since I do represent the Gates Foundation here, I'm still a Gates Foundation staff seconded to the Global Financing Facility. Your point is very important. Gavi was a major thing, but I should also mention that since the Gates Foundation is a learning institution, we have learned that in order to maximize the impact of investments, we do need to also invest in the delivery systems in primary healthcare. And as you well know, something we never talked about a few years ago, which was primary healthcare and systems support, is now what we do talk about. And that's also why the Gates have invested in the GFF. We are a partner in that, because of the point that Amy raised also around how can we get greater sort of catalytic effect of the investments we make, greater synergy. And I can't comment on the global level, but if you take a country perspective, how can we get local investors around the table? And that's what the GFF is trying to do, is to create a country platform, government-driven, but where also the CSO community plays a key role in keeping governments accountable. So I want to add that, plus the private sector gets an opportunity to engage at the country level, because what I think you mentioned here is we can't really continue to go disease by disease. We cannot continue to really, in a very fragmented environment, not try to make efforts that bring greater harmonization and alignment, whether it's we think globally or at the country level. So I can comment more from the GFF sort of country-driven approach, which tries to bring partners together and align a few results to which we held ourselves and governments accountable.
Thank you very much. I think everyone feels that this was really a tremendous session, and so let's thank our speakers. You did